My name is Beatriz Valencia. I'm the Office of Immigrant and Refugee Affairs Liaison at the City of Albuquerque. We want to welcome you to the webinar series, Community Care, Information on Immigration for Healthcare Providers. Thank you so much for your patience. We have a wonderful panelist group that is ready to rock and roll, to give you great information and that is very pertinent to our communities. Today's topic is about immigrant-friendly policies for the city of Albuquerque, Bernalillo County, Albuquerque Public Schools, and the Department of Health for the state of New Mexico. So as a disclaimer, I just want to tell you this part that this presentation is for informational purposes only and does not constitute legal advice. For specific legal concerns or questions, please consult with a qualified attorney or legal professional to ensure compliance with current laws and regulations. The City of Albuquerque and its partners are not responsible for any action taken based on the information of this presentation. Out of the housekeeping part, be respectful and kind. Feel free to type your questions in the Q&A box in English or Spanish. We also have questions that will be answered in that period of time in the question and answer. And we have a Spanish interpretation available. And for tell us how to use that application, Denise is ready here to speak.
Good afternoon. Buenas tardes. Tenemos interpretación disponible de inglés al español. Para acceder a la interpretación después de estas instrucciones, podrán seleccionar un icono que aparecerá al fondo de la pantalla. Pueda que lo encuentre al pulsar el icono con el círculo y los 3 puntos. De la lista que saldrá, seleccionará español. Si está en su teléfono o tableta, tocará la pantalla para activar los botones que aparecerán al fondo de la misma. Seleccionará los 3 puntos, luego seleccionará interpretación y español. To access language interpretation from English to Spanish, you will click on the globe icon that will appear after these instructions at the bottom of the screen. It may be available under the More icon, with this, which is a circle with the 3 dots. You may then select Spanish. If you're on your phone or tablet, tap the screen to activate the buttons at the bottom of the screen, select the circle with the 3 dots, then select Interpretation and your language. Please remember to speak slowly and clearly only in the language you have selected. Thank you.
Thank you so much, Denise. And now we are ready. So we wanted to give you an overview of the Office of Equity and Inclusion, that is one of the offices in the city of Albuquerque, who is responsible to have that connection with the community that, for example, have a vision about the people of Albuquerque in all backgrounds, or greatest asset, and have what they need to thrive. Our mission is to inspire and equip city government to make Albuquerque a national role model on racial equity and social justice. The goals of the Office of Equity and Inclusion are to develop a city workforce that is representative of all levels of demographics of the city, increase local purchasing and business dealings with companies owned by people of color, invest in areas of the city that have been underinvested, and ensure that the city delivers city services in an equitable and inclusive manner. When we talk about healthcare providers, that's one of the fields that right now, with all the changes in the federal policies, that we need to deliver information that can create equitable and inclusive manners of approaches. So this is the Office of Immigrant and Refugee Affairs. That's the office that I oversee. Like you see, just like people enjoying the part of the food, people from different cultures and languages. That's what really real equity and inclusion means. When we all can live in peace, where beyond our differences, we can see our commonalities and come together. So when we talk about the Office of Immigrant and Refugee Affairs, we are talking about improving the lives of all immigrants and resettled refugees who are living in Albuquerque. We make of this work really something that we live it through to our partnerships, our work between the community organizations, agencies, city, state, county, even national, that we work together to be able to understand what is needed to be able to address what the community needs. Parts of the OIRA work is that we facilitate the successful integration of immigrants and refugees into Albuquerque's civic, economic, and cultural life. We celebrate their diversity, and also we advocate in behalf of the immigrant and refugees to promote citywide culture that understand their values and benefits. And when we do that, knowing that there have been so many changes in the last year that have been bringing a lot of awareness of community members coming and asking what we need to be able to inform us of what is going on, to be able to create a sense of awareness as a safety net for our community members. And I know, so no long time ago, a person from Bernalillo County told me the community health workers really need this information, what we can do, and say, well, let's go and plan out something. So we came up with all our partners that we had been working since the pandemic or before, like Karen Gonzalez for the Department of Health, with Enrique from the Bernalillo Health Council, with Antonio Baca for APS New Covenant Refugees, and with many other local nonprofits, and said probably information and resources could be something that could really help our community strengthen and strengthen their way of having that information available for themselves and also to give it to their clients. So this webinar is directed to you, the healthcare provider, the first responder, the one who is in a church, the one who is working in the fire department, the one who is working a community health worker, the one who is a pathway navigator, a case manager, DD waiver, like all the ones that feel that they have that connection with the immigrant community. So that is the part of the introduction. So in the part of the city of Albuquerque, now I'm gonna go and go back to what are the policies that the city has. The city of Albuquerque in 2018 developed this immigrant-friendly city resolution back in 2018 as a response of what it was needed to be able to create some protections for our community regarding their information, their data. This was a recommendation who came from the community, and in that moment, Mayor Keller said, let's go and do this resolution, sign it, and make it happen. So the city of Albuquerque had been adhering to this immigrant-friendly city that still stands today for this purpose. So the Albuquerque immigrant-friendly resolution went into effect in April 24, 2018. And the general provisions are that no city entity can collect information regarding citizenship or immigration status. We are not allowed to ask those questions at the city of Albuquerque by any department unless certain exceptions, except is required by law to determine eligibility for a federal or state program. There are some federal programs that they ask for the citizenship status. There are a state program administered by the city that could ask that, but those are just exceptions. Exceptions to determine the eligibility for city employment. There are some employments that will need that, but not all of them, only some. City employees cannot disclose any personal information about any person they learn as part of their work. They cannot disclose information about social securities. They cannot disclose information on tax ID numbers, place or date of birth, status or recipient of public assistance, disability status, religious, national origin, or even sexual orientation. None of these things can be disclosed to other people, except in order to provide a city service or carry other functions of government, except in a response of an IPRA request where information is not exempted, except when otherwise compelled by the law. There is a new executive order that just came out in July 21st. Why this was necessary? If you at this moment know and are aware of what is happening with all the federal changes, there was a need to strengthen the immigrant-friendly policy who already passed in 2018. And now this one is gonna reaffirm the long-standing commitment as an immigrant-friendly city, and also to outline specific actions to safeguard the rights and the safety of immigrant and refugee communities. Some of the areas that is going to be of your complete knowledge is they have the protection of immigration due process. Everyone needs to have the right to have a due process. Refers that no city department, agency, or employee should use city resources to assist in federal civil immigration enforcement, including raids, detentions, or information sharing unless legally required. This is very important, and that's one of the topics that was added to the new executive order. Implementation and oversight designates the Office of Equity and Inclusion to lead implementation. That means this office directs the Immigrant and Refugee Affairs OIRA steering committee to gather community feedback to coordinate support services with legal providers, schools, and nonprofits. That's part of the role of my office in collaboration with the community. Requires all departments to designate liaisons and report progress to the mayor. But we also need transparency in these city services. So as a result, prohibits city staff from supporting secret ICE activity in public facilities. Also requires departments to report any ICE activity at city facilities to the mayor's office and to the Office of Equity and Inclusion. Allows APD to confirm ICE activity only when requested by the public. Commits to prosecuting individuals who impersonate law enforcement to defraud or harm residents. And overall, requires city departments to review existing programs and services to identify ways to support families that have been impacted by federal immigration enforcement actions. Like you see, until this point, many of these recommendations that are part in the executive order are where the community had expressed that they need a voice. And in the executive order is happening. But we cannot do this part without talking about the transparency in federal immigration enforcement. There are two directives about that. Directs the city attorney to file regular Freedom of Information Act, FOIA, request to DHS, that means the Department of Homeland Security, and ICE, and share findings with the public and city departments. Also reiterates that ICE must clearly identify its officers and avoid harmful or disruptive detainment tactics in public. This is the last part of the executive order, and it's very, very important, knowing that what constitutes our city of Albuquerque are our families, our children. Protection of children, including migrant youth, led by the city's Child Wellbeing Impact Officer in collaboration with all city departments serving youth to develop trauma-informed protocols to support children affected by immigration enforcement. Last part of this executive order is we support for working families. Direct departments to identify services and assistance for families impacted by federal actions, particularly related to housing, healthcare, employment, and education, and expands virtual access to services to support safe interaction with government systems. And if you want more information, here's the email, oei@cabq.gov, and the phone number 505-768-3491. Don't hesitate to ask questions. Now we're gonna have our first panelist. Are you ready? So with no more doubt, I want to introduce you an old friend and someone that is a community leader that always appreciate and respect, Mr. Enrique Cardiel, from the Health Equity Council, representing Bernalillo County today. He's a prominent figure in Albuquerque, New Mexico, known for his work in public health and community advocacy. He currently serves as the Executive Director of the Health Equity Council, formerly the Bernalillo County Community Health Council. Please welcome Enrique.
Thank you, Beatriz. Muchas gracias. And really quickly, I don't represent Bernalillo County. The Health Council used to be a part of Bernalillo County. So we're currently a nonprofit, but I did look up these Bernalillo County policies for this presentation. So ready. And I have to look to the side because I'm on two screens, so I apologize for the profile. I'm ready for the next screen. All right, Bernalillo County has passed some immigrant-friendly policies. The first one that I'm going to talk about is called Strengthening Bernalillo County's Non-Discrimination Policies. And it says that the county will not disclose sensitive information about any person who comes in contact with any part of county government, except when necessary for legal or other issues. And please remind me not to speak too fast for the interpreters. I like to respect the hard work they do. The county will not invest resources to assist in or otherwise facilitate the enforcement of federal immigration laws. So the county will not create funds or programs that do immigration enforcement. Bernalillo County shall refuse access to all non-public areas of their property and facilities by federal immigration agents. So what's important is there's public spaces in most Bernalillo County facilities. And the way I'm understanding this is if federal immigration shows up into a public space, they're allowed there. But if you're in a private space or non-public space of Bernalillo County offices or facilities, that will not happen. And this was passed in 2019. Then next one was done in 2017. It's declaring Bernalillo County as an immigrant-friendly county. Our county commission declared Bernalillo County to be an immigrant-friendly county. And that encourages all public agencies to facilitate the access of immigrants and their families to basic services. The county supports the equal treatment of all persons and states that all persons who live within the county shall have full access to all county services with respect and dignity. So this is important in trying to create an atmosphere that's supportive for folks who are immigrants, migrants, refugees. And this was passed on 14 March 2017. And the next slide, por favor. AR 2018-52 requests the federal government permanently end the practice of separating migrating children from their parents, family detention, and to immediately begin the reunification of separated families. So this is a resolution, right? The county government cannot force the federal government to do anything, but they're encouraging that the federal government permanently end practices of separating families, detaining families, and for any families that have been separated to work towards unifying them. They also asked the congressional delegation to push for laws that end these practices and commits to continuing to look at county policies to ensure that we're able to integrate all immigrant families and individuals into our community with support and integration. And that was passed on June 26, 2018. And I believe that's the last one that I have.
Thank you so much, Enrique, for your presentation. I appreciate that that you came today to support this cause and to help us spread the word about this information that is so needed in the community. If you have any questions for Enrique connected with this resolution, please put it in the Q&A session. The same thing as the presentation I did before. And now we're gonna have also a great person that I also have the highest respect, that is the APS Refugee and E-Commerce Program Manager, Antonio Vaca. Please welcome Antonio Vaca to the presentation.
Thank you very much, Beatriz. Good afternoon, everybody. My name is Antonio Baca, and I'm the director for the Refugee and Newcomer Supports Program for Albuquerque Public Schools. I'm going to talk a little bit about what my department does and the APS policies and procedures that we have relating to immigrant students, as well as recommendations that we have for any immigrant students in Albuquerque Public Schools. Next slide, please. So first of all, our Refugee and Newcomer Supports Program provides case management support to refugees resettled through Lutheran Family Services. We provide these case management supports for around 3 years, depending on need. Secondly, our department provides training and support to schools across the district on the best practices for supporting recently arrived English learners. And third, we also provide classroom support for non-English or non-Spanish speaking newcomers. This year, we're also establishing an international welcome center, which we're calling the Global Hub. And this will be launching, and we'll be having a formal launch in October. And lastly, we are also establishing the very first APS International High School. And this high school is specifically designed to support the strengths and needs of immigrant students across our district. And this includes students from any countries. Next slide. Next, I'd like to talk a little bit about what APS does in regards to supporting immigrant students in our district. First of all, you might recognize this poster. This poster has been shared with all schools throughout our district. That's over 140 schools. And this poster is shown in both English and Spanish at schools to reiterate and reemphasize what we do to support immigrant students. The first thing is we do not require Social Security numbers to enroll students in schools. Citizenship is not a consideration for enrolling students. So any and all students, regardless of immigration status, are welcome in our school district, and we encourage them to be enrolled in school and receiving our high quality education. Secondly, we also do not ask any parents or children about their immigration status. If any student talked about, or any family talked about their immigration status, that information is protected under federal law, and we will not share any of that information with any outside agencies or any outside individuals. Third, we do not allow immigration enforcement to operate on our campuses without a judicial warrant. I will say we have never seen ICE or Border Patrol trying to enter a campus in New Mexico or in Albuquerque. We don't expect that to change. However, we are very prepared in which case if immigration officials did approach a school and tried to enter. The process is very clear, and all of our staff have been trained, including all of our principals, all of our front desk staff, all of our counselors, all community school coordinators, family liaisons, and more. Our directions is that if immigration enforcement did try to approach our school, they would be stopped immediately. And if they had any sort of documentation, they would actually have to go through more processes, which I'll talk about on the next slide. Lastly, we do not share any immigration information about you or your children with outside agencies, period. Next slide. So if any outside law enforcement requests to access a school in Albuquerque Public Schools, and this includes immigration enforcement, their access will initially be denied. Secondly, the staff member who sees this happening must notify the principal immediately. The principal then notifies the APS police department, and they are immediately dispatched to take over from there. If any paperwork is provided, like a warrant, at that point in time, the police department would share this information with our superintendent and our APS legal team to review those documents and determine what the course of action is. So this means that none of our staff are obligated to be reviewing any sort of paperwork or warrants. So that limits any mistakes. That would have to be approved by one of our lawyers. I will reiterate that this has not happened and we do not expect this to happen, but we are definitely prepared and are ensuring that our schools and our campuses are safe. And again, a judicial signed warrant is the only thing that we would be obligated to abide by. However, this type of a warrant is extremely, extremely rare. Next slide, please. Our recommendations to families. First of all, schools are safe and your child's education is very, very important. So it's important to keep your kids in school. And if you have concerns, please reach out to your school principal and they are more than happy. And again, they've all been trained and my department works very closely with all of these principals across the district. Secondly, it's very important that families update their emergency contacts in the APS system. That way, in case anything happens to a parent or guardian while the student is at school, that way our schools can hand over the student to somebody else that the family has decided is a safe person that can take custody of the child. If we do not have emergency contacts and we do not have somebody who we can legally pass off the student to, the student would actually have to go through CYFD. And we want to try to avoid this type of situation if at all possible. So please update your emergency contacts. And this goes for any parents across the district. Third, if your student experiences discrimination, please report it to your principal or the APS Equal Opportunity Services. And we will follow the procedures to ensure that your rights are protected. Lastly, I already spoke on this issue regarding student pickup. Next slide, please. Lastly, this is how to get a hold of my office. Our email is right there. Our student service center can easily connect you with our office. There's their phone number and their email address. And lastly, the contact for the APS Equal Opportunity Services is there for you as well. So thank you very much. And that's it for me.
Thank you so much, Antonio. We really appreciate this information. And this is the perfect time for if you are a healthcare provider, a case manager, a community health worker. When you have this information, we are going back to school. Many of our kiddos in K to 12 and at the university, this information will be very important. I mean, for you as a parent or as a neighbor, as a relative. So please share the information as needed. Appreciate it. So our next presenter is Karen Gonzalez. I know Karen, back in the day when we were doing a lot of things connected during the pandemic, I think prior to that probably, doesn't it, Karen? Yes, she always has been so close to our community. So we want to really welcome Karen is the Refugee Health Program Manager in New Mexico Department of Health. In this role, she is responsible for providing newly arrived refugees with integrated medical and mental health screening. And she can tell you more about her program because it's better to come directly from the person who does the work in this aspect. And we are very blessed to have you here today. Please take it away.
Thank you, Beatriz. As you mentioned, my name is Karen Gonzalez. I'm the Refugee Health Program Manager with the New Mexico Department of Health. The Refugee Health Program, we're a fairly small program. We have 2 offices, one in Albuquerque out of the Southeast Heights Public Health Office, and then down in Las Cruces out of the Las Cruces Public Health Office. And we offer initial domestic health screenings to newly arrived individuals. That includes both physical and mental health screenings. We provide referrals to primary care and specialty care providers. We work closely with healthcare providers as well as managed care organization care coordinators to help clients learn and acclimate to the U.S. healthcare system, which can be difficult for anyone to navigate, but especially individuals who are used to a completely different model of healthcare. Another big focus for our program is on health promotion, and we work with community members and local organizations to provide educational programs geared toward refugee communities as well as the providers who serve them. Next slide, please. The New Mexico Attorney General's Office issued guidance in January of 2025 to assist New Mexico healthcare facilities who may have to respond to immigration issues. I believe Beatrice has included the full document in the Google Drive. This is just a little bit of an excerpt. The governing law for these recommendations is, of course, the Fourth Amendment. It permits law enforcement officers to approach an individual and ask questions without any level of suspicion, as long as the officer does not act in a manner that causes a reasonable person to believe that the person's not free to leave. Law enforcement officers may also not detain an individual in the absence of reasonable suspicion. Law enforcement officers may make warrantless arrests, meaning they don't need a warrant to make an arrest in a public space based on probable cause, even in the absence of exigent circumstances. Immigration officers are permitted to make warrantless arrests if they witness a person entering or trying to enter the U.S. unlawfully, or if they have reason to believe that the individual has committed a federal felony. And under the Fourth Amendment, law enforcement officers may arrest someone without a court order if they believe that the person entered into the country unlawfully and is likely to escape before a warrant can be obtained. So these are some of the guidelines that were put out for public health as well as other healthcare facilities in terms of what is allowable on healthcare facility sites. Next slide, please. One thing to note is the U.S. Department of Homeland Security has designated hospitals and healthcare facilities as protected areas at which immigration enforcement actions should generally not occur. That doesn't prohibit them from occurring at these sites, but if there are any immigration activities that are happening, like questioning or just presence, it should be done in a manner where they are as inobtrusive to the healthcare facility, and it's so respectful of clients' privacy. Healthcare facilities may also choose to designate areas where law enforcement officers are not able to enter without the facility's consent, warrant, or exigent circumstances. For hospitals, they have their own specific areas, but specifically for public health, that would be back in our exam rooms or in our pharmacy. Those areas are closed to the general public for the safety concerns of clients and the protection of their privacy. There's also the Health Information Portability and Accountability Act, HIPAA as it's more commonly known. This establishes federal standards for the confidentiality, security, and transmissibility of healthcare information. HIPAA-protected information must be withheld unless limited exceptions apply. So Department of Health or any of its facilities will not disclose or share health protected information, which includes names, addresses, phone numbers, dates of birth, basically any information that can be used to identify a person either individually or in combination with other information. All of that is protected under HIPAA. Next slide. So what are the DOH policies? New Mexico Department of Health provides healthcare services to the public without asking immigration status or immigration documentation, for the most part. So anyone can walk into a public health office and request adult or pediatric vaccine, family planning services, tuberculosis treatment and testing services, harm reduction services, screening and treatment for sexually transmitted infections, HIV testing and counseling, WIC services. So this is supplemental nutrition for women, infant, and children, up through the child's 5th birthday. The exception to public health services being provided without asking for immigration documentation is for the refugee health services. And that's because the refugee health program is primarily funded with federal funds. And part of our requirements are to determine a client's eligibility to participate in services. But again, these services are happen at very few offices. Like I said, the Southeast Heights Public Health Office and the Public Health Office down in Las Cruces. And staff have been trained on how to speak with clients so they understand why the documentation is being asked for. And again, it is so we're able to offer a wider variety of services as opposed to limiting services. Clients should never be afraid to access healthcare because of fear that either their information or their family's information will be disclosed. Public health staff adhere to strict HIPAA guidelines. Protective health information is not disclosed without appropriate consent of the client. There are some exceptions where it would be permissible, and that would be, to disclose information for billing purposes with insurance companies. But even at that, clients are asked to sign written consent before any information is disclosed. If law enforcement or immigration enforcement officers were to enter a public health office, present whether it be a subpoena, a court order, or a request for information, all this information would be turned over to our chief privacy officer, and our Office of General Counsel. They would review the materials and respond appropriately. The staff at the public health offices or other department staff would not release any information to anyone requesting information about another individual. And as I mentioned before, access to public health exam rooms is limited to authorized staff and clients for the protection of the client's privacy and medical safety. Are there any questions? Well, that's all I have. I'll be happy to answer questions.
Thank you so much, Karen. We very soon we're gonna touch bases in the questions. I know that there is interest from the people who are viewing the webinar, so just give it just a second. Meanwhile, this is the most common question in the last 7 months. Where are the red cards? In how many languages can we have it and where we can find it? Well, one of the places that you can find it is online. They are in 14 different languages, and we're gonna share the link later on in the chat for you to have it, or in the website actually. But it's available for you to access it. Also, tomorrow there is cruising back to school. How many of you know by any hands that tomorrow is Cruising Back to School event in Cesar Chavez Community Center and West Mesa Community Center, where they're gonna give backpacks to many, many families. You're gonna be able to find these race cars there because we're gonna be sure to bring it to you. Okay, next one is other resources that you can find. The city of Albuquerque and the state of New Mexico has so many resources for the immigrant community. We are really blessed to have so many community organizations, agencies who are interested in building and strengthening our community. Well, we start with our Office of Equity and Inclusion. We have a really nice and comprehensive website that you can go and visit. The Immigration and Refugee Affairs, that's my office. There are, you can see the list of partners, areas with Know Your Rights. You can see information about past webinars that we did specifically with many questions in the past connected with businesses, community, and many other topics of great interest for you. Small business office, believe it or not, this is something that this year has been of a high need because people want to know, okay, how knowing your rights in a business place, in the business works out. So we have webinars that have been recorded about that topic. They also have many other resources that you can take place. And when you're talking about, when you are talking about a health center or a clinic, that is a business, doesn't it? Even a nonprofit could be considered a business, even if it's not necessarily for profit. So you're gonna find wonderful information in the small business office. El Centro de Igualdad y Derechos, that is one of the local nonprofits, has done a great amount of advocacy, and they also have resources and information. ACLU of New Mexico, they do even a lot of trainings right now in that you can ask them to be able to participate. And the only consulate in the whole state of New Mexico is the Mexican consulate. And we are so fortunate to have Consul Patricia Pinzon and her team working here locally and serving our community. Go and see these services. They have great amount of services for you. New Mexico Center on Law and Poverty, New Mexico Immigrant Law Center, Catholic Charities of New Mexico, Lutheran Family Services, and the list go on and on. And I don't want to forget that one of the organizations that is here with us as well is some of the ones who already spoken before. National resources. I don't want to go to the whole list, but these are some of the organizations that you can touch bases later on. And this information is gonna be uploaded after we have the recordings in our websites, and it's gonna be shared with all of you in English and in Spanish. So if this is the time for Q&A. So are we ready? What questions are there? Who can tell us some of the questions? Well, for now, I can tell you one of the questions, and that comes all the time here in the city of Albuquerque, and I'm pretty sure also at your door. Where I can find information about Know Your Rights? Well, right now is very much readily available. But if any of your organizations, I don't know, in the schools, for example, Antonio or Karen or Enrique, where people can find information about Know Your Rights, those questions are for you. I just return it to you to see what response you can have and give us some ideas.
I know Lutheran Family Services, Catholic Charities, and Los Cumbres Community Services have been providing working together with other organizations and providing Know Your Rights workshops probably for the last 7 months. They've developed toolkits to help families identify what resources would be necessary to make sure that their families are taken care of in the event that one or both parents are detained. It goes through a list of, to really help folks identify, what could potentially happen if one or both individuals are detained, what type of resources would be needed. So I would say I can put their contact in the chat if that is helpful, or I can send it to you and you can circulate it to the group.
That would be wonderful, Karen. I totally appreciate that type of information for our community. For the part of Enrique or Antonio, what the people can find Know Your Rights in the schools or in the community?
So a lot of our schools do partner with local nonprofits such as El Centro de Igualdad y Derechos and also the New Mexico Dream Team to provide Know Your Rights trainings at schools through their community school coordinators or family liaisons. So many of those events are happening at the school level. And also, I will also make a shout out to our New Mexico Dream Team because they also have a number of chapters at different schools throughout APS. So these are really great resources for kids experiencing this, whether whether they're undocumented or in some other status. But it's a great group that they can connect with, and that's more of a long-term deep dive into knowing their rights and also support for their parents as well.
Thank you, Antonio. Enrique, do you have any organizations that you work close with about Know Your Rights?
I think you had mentioned all the organizations, but I think also that many other groups outside of our normal nonprofits are working on this. So if you go to Albuquerque Mutual Aid, you can also get information there. The folks there are keeping track of what's going on, and they've had cards and that type of information. So I think that it's very it's spreading wide out in the community. I've seen stickers in the international district on poles and different things like that where people can it has the information like how to find somebody if somebody's picked up by ICE. So I think there's a lot of more information out there than we're able to track at the moment. And so I think that's important. And to, I know neighbors are talking to each other and sharing flyers, by text. So I think really it's important to just talk with your neighbors. Most of us know at least one immigrant, if not more. And so I think it's important for us to share with them what we know and what places we know how to connect.
Thank you, Enrique. There is another question that always have come over this period of time over and over, and it has to be with family planning. And I know that you as a healthcare provider, as a case manager, that is one of the things that you also are concerned for your patients or your clients or your families. How they can plan ahead to be able to have, to consider a power of attorney. It could be for the schools or for healthcare or for your belongings. What type of resources or information or how you will refer people in these places? This question is for all three of you. I don't know who wants to start. What you will recommend for the people where they can find information to do the family planning correctly?
Well, I'm going to get out of this really easy because I'm going to say I always send them to Department of Health.
You send them to Department of Health for family planning services or for resources more in line with like a power of attorney?
Family planning.
For family planning services. That is one of the public health services that individuals are able to obtain without being asked about immigration status. So they would be able to receive birth control services, of, the referrals for other care, like starting prenatal care if that's what they needed. people can pick up condoms at public health offices for free. And I believe they also have a sliding fee scale, but for individuals who aren't able to pay for the services, those services are covered as well.
Thank you so much, Enrique and Karen. The other question that comes to place is how a part of the people how to contact you is if anything comes related with your different entities connected with immigrant populations, what is the best way to contact your organization? What is the fastest way? Or you have a website that you will recommend to people to get this type of information from?
Individuals who are looking for healthcare services, we have public health offices located in 33 counties throughout New Mexico. They can either go into Google and type out the county that they're looking for services, or they can go to the DOH website and there'll be a list of services there. If they have if they're interested in refugee-specific services, they can contact me at the information that you have listed. Or if they're in Albuquerque, they can reach out to the Southeast Heights Public Health Office. If they're down south, they can reach out to the Las Cruces Public Health Office.
Thank you so much, Karen. Antonio, what will be the best way to contact your office?
For healthcare workers in general, I think they can reach out directly to me. You're welcome to use my work email or my work cell. So I don't know what the best place is to put that, but my work email is under my first name, Brandon, Brandon .baca@aps.edu. And then my work cell is 505-803-7781. And just in case that wasn't caught for interpretation, one more time, my email address is brandon.baca, that's BRANDON.baca@aps.edu. And my work cell is 505-803-7781.
Thank you, Antonio. Enrique, how we can contact you?
Best way is also email. So Enrique, ENRIQUE @healthequitycouncil.net. It's very long. HEALTHEQUITYCOUNCIL.net. And that's the best way to get a hold of us. And we're very much trying to support folks as they deal with all the issues of concern at this time.
Thank you so much, Enrique. And with that final remarks, I want to show you everybody who got involved. Oh, before we leave, we have upcoming webinars. Yes, the next webinar is on Friday, August 22nd. And we're gonna talk about Know Your Rights training on medical and behavioral health spaces. Don't miss out, this is very important. And we have a great partner and local nonprofit doing this presentation with the support of other organizations. So don't miss out. Everything is gonna go to the QR code and you can enter to the link. And next one, I want to show you how many organizations are involved in this effort. Partners and organizers. New Mexico Department of Health through Karen Gonzalez. Yay! Bernalillo County, we have members from Bernalillo County. They are the ones who refer us here back. UNM Hospital, Albuquerque Public Schools through Antonio. Health Equity Council, Enrique. El Centro de Igualdad y Derechos, Resettlement Life, Lutheran Family Services, Encuentro, New Mexico, Mayor's Office with Angelica. Angelica, come on, show us your face. Let's see if she's over here, come on. Consulado de México, New Mexico Immigrant Law Center. So as you see, this is a real partnership. We don't, the city of Albuquerque, we don't do things alone. We do things together. I appreciate very much every single one of you. And just to respect your time, it's 2:59. We're almost at the end of this presentation. So thank you so much. We see you in the next 2 weeks. Thank you so much.
Beatriz, we have one question that came in.
Oh, okay.
What is the turnaround response time? And I'm not sure what that question was in reference to. Sorry, I just didn't want to end it without addressing that. Gigi sent this question in.
Can you repeat the question if you don't mind?
What is the turnaround response time?
For the city of Albuquerque or for other entities? Because every entity has a different response time. The city of Albuquerque has a response time of 72 hours, but my office responds in the next 48 hours or less.
Same with our office, 24 to 48 hours.
The public health offices are open Monday through Friday from 8 until 5. And you should have between a 24 to 48 hour response time.
I hope that answers your question, Gigi. If not, please feel free to reach out to me. I think you have my contact info.
Well,
Thank you, everyone.
Thank you.
Thanks, everybody.
Thank you.